Today's lecture is about the arthropods causing toxemia and allergy. I am Dr. Fadwa Mustafa Arafa and I am a lecturer at the Medical Parasitology Department. Today's lecture is very important and it has many clinical applications in your life. As a house officer, a general practitioner, a pediatrician or a dermatologist, you may encounter many of the arthropods causing toxemia or allergy. And that you have to know them and you have to know how to manage this, the conditions caused by these arthropods. First, we will start the first part of the lecture about the arthropods causing toxemia. We will study two arthropods. First, the scorpion, second, the tick. Scorpion causes toxemia through the scorpion sting, and the tick causes toxemia through the tick bite. First, the scorpion. The previous lecture was about the classification of arthropods, and you know that arthropods are classified into different classes, and one of them is class Arachnida. The scorpion belongs to Arachnida. The body is formed of cephalothorax, which means fused head and thorax, and then abdomen, which is segmented. The last part of the abdomen contains telson and stinger, which is the venom apparatus. How does this venom apparatus work? Imagine a syringe with container and then a needle. The container contains the fluid or the drug you want to inject, and then the needle injects this drug. Here, the telson contains the venom, and then it is injected through the stinger as if it's the needle of the syringe. Okay, and this is called a scorpion sting. Here, the mouth part is not responsible for anything. The venom and the injection of the venom is a function of the telson and the stinger. Here, the mouth parts only hold the prey if it is small prey, but does not inject anything through the mouth parts. Only the telson and stinger are responsible for the venom injection. How do you meet a person stung by scorpion? Usually in a remote area where scorpions are present, a desert area here in Egypt, in Upper Egypt or Sinai. Usually these scorpions prefer to hide in the dark places during daytime, and then you walk on them unaware of the scorpion. They might hide usually inside the shoes, and you are unaware there is scorpion inside, and you wear your shoes, and then you are immediately stung by the scorpion. So beware of walking barefoot, especially in deserted and remote areas where they hide. Walking barefoot, you might step on a scorpion, or you might be stinged in your extremities, hands or legs or whatever. The patient will come to you having symptoms which start local and then proceed to systemic symptoms. What about the local symptoms? First, at the site of the sting, there is an immediate, intense aching pain. And this pain is followed by burning sensation in the area of the sting, which radiates from the site of the sting. Here, the site of the sting and the radiating burning sensation. And there is affection of the regional lymph node. There is lymphadenitis. What about the systemic manifestations? This venom will be released into the systemic circulation, causing toxemia. Toxemia will be presented as generalized numbness, throbbing, and twitches, especially of the extremities, the fingers, toes, and tips of the nose, earlobes, and chin. Also, toxemia causes fever and vomiting. Nervous system affection, autonomic nervous system, will lead to profuse sweating and excessive salivation. Nervous system involvement is also present. For example, glossopharyngeal nerve involvement will lead to difficult speech and swallowing. There is also muscle involvement in the form of abdominal muscle spasm and convulsions. This toxemia also affects the brain, and mental disturbances and hallucinations can also be observed. How to diagnose such case? Do I need laboratory investigations? The diagnosis mainly depends on the careful history taking and clinical examination. So the diagnosis here requires taking full history, and here you will find the typical history of being stung by scorpion together with the typical clinical picture, either local or systemic. How to treat such case? First, we have local treatment, the first aid treatment. If you are present in a remote area, the patient comes to you, you have to stabilize him and do this first aid treatment. If you are in a hospital and you are a specialized doctor, you will carry on the general treatment. First, the local treatment. The most important thing is to calm down the patient. This patient is frightened, is stressed, and thinking that he or she will die, and this stress will cause the release of stress hormones. Stress hormones will cause tachycardia and pumping more of blood. This lead to absorption more and more of the venom into the general circulation, and appearance of general symptoms and effects of the nervous system early on. So we have to calm down the patient and reassure the patient in order to decrease the release of these stress hormones. This is followed by using a tourniquet. This tourniquet is ligated proximal to the site of the sting. What's meant by proximal? Nearer to the heart. The main purpose of using this tourniquet is to prevent systemic absorption of the venom. So you have to put it proximal to the site of the sting. This is followed by what? Incision over the sting. This incision will allow free flow of blood and will wash the venom to outside. We might have a dressing soaked with disinfectant, potassium permanganate. This disinfectant will oxidize the venom and help in management. Finally, this patient is having an intense aching, pain, burning sensation. You have to decrease this pain sensation and manage the condition. As we already said, if I decrease this pain, I will relieve the stress and I will decrease the systemic absorption of the venom. So here, local anesthetic is important to decrease the level of stress. What about the general management? For the general management in a specialized hospital, you have to put in mind what are the main causes of death. Here, the cause of death might be respiratory failure or shock. So I have to start with monitoring my ABCs: airway, breathing, and circulation. The main points here is to stabilize the patient. You have to keep the airway clear of any saliva or any secretions. You have to make sure no nervous affection, and you have to keep the airway clear. So the first line is the maintenance of airway. So ABC, airway and breathing. C is the circulation. You have to monitor the vital signs, to take the blood pressure, and to know if it is starting to drop, so the patient is starting to get into shock. You will have to use IV infusions and hydrocortisone to stabilize the patient. So the main points of general treatment are to prevent death. Here we'll start by stabilizing the airway and breathing, and then circulation. Maintain the airway, maintain the blood pressure. After ABC, then we'll have to manage each case accordingly. Do we have any other symptoms? I check other lab diagnosis here, but start to look for electrolytes, glucose, and whatever the patient needs, I will give to him or her. So we'll start general supportive treatment. Next on, I started by getting local anesthetic to relieve the local pain. In the hospital, I can administer oral or parenteral analgesic to manage this severe pain. Okay, and finally, the specific treatment here, which is anti-venom, which will counteract the effect of the venom. Here it is given intramuscularly. So this is the general treatment of scorpion sting. So we finished scorpion sting. The second part about arthropods causing toxemia is the tick bite. Here you can see a tick with the inserted mouth parts into the skin layers. And this bite will be responsible for the pathology. Insertion of the mouth parts of the hard tick, here like the first picture. The mouth parts will be inserted. Mechanical destruction will be caused at the tissues locally. This will attract inflammatory cellular cells and will cause inflammatory cellular infiltration, accompanied by hyperemia, edema, and hemorrhage. The cause is this mouth parts. Here it is magnified. The mouth parts are responsible for this trauma, and this condition is worsened if I try to forcibly remove the tick. There is a certain method to remove the tick. We'll talk about it later. But here there is a small tick, and after taking a blood meal, you will see it expanded like this. Okay, this condition is called tick dermatosis. Another important condition is toxemia caused by tick. If the tick is present anywhere in the body, it is dangerous, but it's more dangerous if it is present at the back of the neck or along the spinal cord. Here the tick could release a neurotoxin, and this neurotoxin will be released and reach the the central nervous system directly, and will cause a condition known as tick paralysis. So here the tick is very dangerous if it is present in the back of the neck or along the spinal cord. Here It will inject the neurotoxin with the saliva, causing tick paralysis. What is this condition which is called tick paralysis? It's a case of generalized toxemia. The patient will come to you with fever, a rise in temperature, and the neurotoxin will cause rapid ascending flaccid paralysis. What's meant by rapid ascending flaccid paralysis? It's rapid in nature, as we said, especially if the tick is present along the back of the neck or along the spinal cord. It will start from the lower extremities and ascending till it reaches the respiratory muscles. Flaccid because the muscles are relaxed. So it is ascending flaccid paralysis. Here, it will, if it reaches the muscles of respiration, there is difficulty in breathing. Also, there might be difficulty in swallowing, and this condition could be fatal. So the causes of this here could be the toxemia caused by the toxin, or the rapid ascending flaccid paralysis, or the respiratory failure. So I have to take care. If we have a tick bite, I have to remove the tick carefully in order not to release the toxin causing tick paralysis. How to do this? We'll talk about it later. Here, also, heavy infestations with the ticks will cause blood loss and anemia. Finally, we'll talk about treatment. Here, we have to remove the tick, the hard tick, very carefully. How? You have to relax it first by chloroform or ether to make it release its hold from the skin tissues. If it, when it is relaxed, it will be easily removed. So after using chloroform or ether, easy removal of the hard tick is by traction. You will take a forceps and grasp this tick near the mouth parts and remove it by traction. This small video will show you that here the tweezer or the forceps holding the tick near its mouth parts, and then gentle traction till it is safely removed. You have to make sure you did not remove only the body, leaving the mouth parts. If you left the mouth parts, saliva will still be released and it may contain the neurotoxin and may cause tick paralysis. Beware of ticks. You have to remove the whole tick with its mouth parts. The second part of this lecture is about arthropods causing allergy. This subject is also interesting, and you will meet these arthropods in your daily life or in your practice. First, arthropods causing allergic dermatitis. You have already heard the names mosquitoes, fleas, less commonly bugs, lice, and finally the mites. Cercoptes scabiei mite, which is called itch mite, which is responsible for a disease called scabies. You might hear about it. And other arthropods causing allergy through inhalation. Here there is one example, which is house dust mites. First, we'll start with arthropods causing allergic dermatitis. First one is the mosquito dermatitis. Here, the mosquito, all of you have already been bitten by a mosquito at any time of your life, and this mosquito will start taking blood meal, female mosquito, by inserting its mouth parts into the small venom. During this feeding, the female will inject some of the salivary secretion before taking the blood meal. This salivary secretion will cause the allergic reaction. Some people have high susceptibility to this salivary secretion. They will have a severe allergic reaction. Okay, so the mosquito dermatitis is due to their salivary secretion, and some people will have severe allergic dermatitis. The second arthropode causing dermatitis is the fleas. Flea dermatitis is caused by bite of the flea. Also, this bite will cause local allergic reaction in the form of reddish edematous indurated papules, or even with secondary bacterial infection it will form a pustule. Here also a local allergic reaction. The third one is the bug dermatitis. Bed bugs are less commonly known than mosquitoes and fleas, but still present in areas where there are cracks or poor living conditions. These bed bugs will hide inside these cracks or below the beds, and will come out at night crawling to find a blood meal. If they find the host, they will attach to it and start taking blood meal. Of course, they can cause dermatitis due to allergy to their saliva. If they take large blood meal, frequently attacking the host, and it will cause anemia. And finally, this bug crawling and biting the person at night, it will cause some annoyance and sleep disturbances. The fourth type is the lice dermatitis. You have already heard about the lice in the introduction, and at some point, you know, there's head lice. Head lice is common in children, in school children. They might infect each other with the arthropode. But here we are talking about the body lice, which can cause allergic dermatitis. How does this arthropode cause allergic dermatitis? This lice or single is louse. This louse can attach itself to the clothing, to the inner parts of the clothing, instead of the hair louse, which the adult attached itself to the hair shaft. But here they attach themselves to the clothing. These lice will also take blood meal, and the salivary secretions will cause irritation. This irritation is chronic in nature because of frequent biting, and this infestation could be continuous for years. How does a person is infested with this lice? Usually it is in person with poor hygienic measures. Usually it is mentally unstable or homeless person living in the streets, no access to clean water, clean clothing, and then this person is infected with the lice. This body lice will cause this frequent biting and chronic irritation. The patient becomes hypersensitive and develops a special form of dermatitis associated with pigmentation. These are bronze pigmentation together with pustule formation, and this infestation leads to is going on for years, leading to darkened skin and a condition known as vagabond disease. The vagabond is a homeless person, and here this vagabond is infested with the lice, body lice, and having this chronic condition This chronic condition is characterized by bronze pigmentation and pustular formation. The fifth parasite or arthropods causing allergic dermatitis is the Sarcoptes scabei or the itch mite. It causes a disease called scabies. You may have already heard about it. Here, this disease is common in areas where there is overcrowding and poor hygiene. Like what? What are the situation leads to this? It might be present in mental institution. It might be present in prisons or jails, in refugee camps, orphanage, any areas where people are crowded, no access to clean water, clean clothes, and poor hygiene. This mite responsible for the condition. The male fertilizes the female on the surface of the skin. Then the fertilized female penetrates through the horny layer. This is the horny layer formed only of cuticle called stratum corneum, and then the cellular layer or the epidermis. The female starts burrowing this horny layer through the horny layer and then through the epidermis, resulting in the formation of tunnels. And during this journey, the female will lay down eggs and leaving behind fecal pellets. Here, the male with the female mating on the surface of the skin, and then the female burrows through the tunnel and leaving behind the eggs and fecal pellets. Here the primary lesion is the tunnel, and we have already said this, the tunnel will cause the allergic dermatitis and forming pleomorphic lesions. These pleomorphic lesions will be in the form of erythema, multiple scratch marks first, erythema, papules, nodules, vesicles containing clear fluid, or secondary bacterial infection may occur forming pustules. So the complication is secondary bacterial infection and pustule formation. The usual sites involved are the areas with soft, moist, and thin skin. The most commonly affected site is the interdigital spaces, followed by ulnar aspect of the arm, the elbow, axilla, then breast, umbilicus, and groin. In the back, the shoulder, the back, and the buttocks. So areas of soft and moist skin areas like the interdigital spaces, ulnar aspects of arms, elbows, and axilla, breast, umbilicus, groin, and finally the shoulder, backs, and buttocks. حصل ازاي الهايبرسنسيتيفيتي رياكشن ده؟ المايتس وهي feeding, while the mites are feeding on the tissues, they deposit minute fecal pellets, and these minute fecal pellets will cause hypersensitivity reaction, type 1 hypersensitivity reaction, in the form of vesiculations and severe pruritus. This will be intensified by the worms and perspiration, and this occurs usually at night, so there is nocturnal itching. Worms and at night will activate the mite to produce an acidic secretion, and this acidic secretion further intensifies the itching, and a vicious circuit is formed. The mite produce fecal pellets, which causes allergy, and then this allergy is intensified by worms and perspiration, which further activates the mite to produce acidic secretion, which further intensify the irritation, and the vicious circle is formed. So here we finished the first part of arthropod causing allergy. The second part, arthropods causing allergy, is through inhalation. Here we are talking about allergenic mice in house dust or house dust mites. Another name is Dermatophagides farini. These mites are present on the floors, in the dust on the floors, furniture, and mattresses or beds. And these mites could be inhaled and cause allergy. They are present there, feeding on dead skin or other things in the dust. They themselves can cause allergy by allergens in their bodies or body fragments or feces. They can also concentrate potent allergens and around them and causing allergy. Allergy is caused by inhalation of such mites and allergic reaction in the form of rhinitis or asthma. It occurs usually during getting to sleep, and you will inhale the dust on the mattress or the bed, or during cleaning, vacuum cleaning, and the dust is in the air and you inhale the dust and the mites inside the dust, and you fear rhinitis or asthma. Okay, that concludes our lecture. Thank you for listening. Thank you.